Our team coverage continues with News 8's Heather Walker, who's digging into a new executive order requiring implicit bias training for healthcare workers.
We begin with political reporter Rick Albin with what the concerns are from the governor and her push for people to mask up. Rick.
The governor and the state health leaders are growing more and more concerned about the numbers they're seeing, and they say they're seeing people gathering in masses, not wearing masks or social distancing. And we can now see it steadily driving up those numbers of the people who are infected. In fact, right here in West Michigan, Grand Rapids is by far the coronavirus hotspot at this time. The Grand Rapids region is reporting 45 new cases per day per 1 million people. Detroit, Lansing, and Kalamazoo all seeing just above 20 new cases a day per 1 million people. Jackson, Traverse City, and the Upper Peninsula regions all under 20 new cases per day. But the governor cautions the UP is seeing more new cases now than at any other time during the pandemic. That's why she's getting serious about masks. She says it's the law, and you have to wear a mask when you're in a confined public space, and that she may get more strict with enforcement if that doesn't happen. She also suggested that everyone should urge others to wear masks. I ask, how does that work?
We've got to implore one another to step up and to do the right thing. And Michiganders are smart, we're tough, we can figure out how to do it politely, but also forcefully, because it's on all of us. If we're going to get our kids back in school in 8 weeks, we've got to at least stay in phase 4, if not move into phase 5. And on the trajectory we're on, it's very much in question.
Okay, Rick. You've talked a number of times about considering further measures about getting people to wear masks. Is that based on penalizing the stores or the businesses or the owners, or is it individual enforcement? I mean, I know you've suggested that we gently nudge people at the store, but that's a lot easier said than done.
I know it is. And, you know, I feel for businesses that are doing all the right things, and for their clerks, the store clerks at the front door, or, you know, who are confronting or being confronted by customers who are unhappy about the mask requirement. And yet, these businesses are also asking for tougher rules so that they can point to it and say, this is the law of the land. Right now it is required, and for some reason people don't seem to know that, and that's why I wanted to reiterate that today. It is required that people wear a mask if you're going into a place of accommodation, public accommodation that is inside. You're supposed to be wearing a mask, and that is the law of the land. There are perhaps additional things that we can, steps that we can take, and I would anticipate you'll be aware of what those are in the coming day or few.
So the governor seems to indicate that whatever additional measures she may take would come in the next day or few. I'll be talking with the governor tomorrow, and perhaps then we'll find out how she hopes to get more people to wear those masks in public. Brian?
Rick, we were talking off camera just based on our own personal observations. The mask-wearing public and the non-mask wearing folks, there's already a lot of friction there. I don't know if anyone wants to get involved in that, and that includes some of those store owners.
Yeah, I think that's exactly right. And the governor has talked about this in the past, that what is, from the perspective of the health departments around the state, is what a health issue is, has become a political issue for some people. And so the idea that you would suggest to somebody, even presumably somebody you don't know, that they should be wearing a mask, could be the beginning of something you don't want to get involved in. But we also know that we see a lot of people who are wearing masks. We see another number of people who aren't wearing, and at least the health community is urging people to wear those masks, because as our cases go up, if hospitalizations and deaths start going up, the governor has said she might have to start turning back the dial, meaning closing some businesses, and that could be really devastating on an economy trying to recover.
Yep. Good points. Rick Albin, thank you.
Also, during the press conference, the governor announced a new executive order mandating implicit bias training for all licensed medical professionals. The governor says state data shows COVID-19 is about 4 times more prevalent among Black Michiganders than white Michiganders, adding that this order will help end racial disparity when it comes to health care. News 8's Heather Walker is learning many hospitals already have the training in place. Heather?
That's right. We reached out to local healthcare professional unions and area hospitals. They all tell me that there is implicit bias training in place, at least for a portion of their staff. Spectrum Health, the largest healthcare provider in West Michigan, saying today, we have already been deep into this work. We have been intentionally delivering implicit bias training since 2015 and increased our efforts upon signing the 1, 2, 3 for Equality Pledge in 2017. It is a core part of our comprehensive development and not just training to check the box. Mercy Health and St. Joseph Mercy Health System saying over the past 2 years, we've conducted multiple leadership development forums organized and supported by the human resource organization effectiveness team. These forums focused on the development of 1,100 leaders through training programs such as unconscious bias. We recognize that there's much more that needs to be done as a health system. We will continue to advocate for justice in order to change the inequities that exist among people of color. Bronson Health said Bronson Healthcare wants to do whatever we can to eliminate health disparities, and we believe implicit bias training is one of the many ways to advance those efforts. The Michigan Nurses Association says nurses provide the majority of direct health care, and the Michigan Nurses Association looks forward to helping shape the implicit bias training program for health professionals. It is important to acknowledge and address inequalities in our healthcare system. We believe that the governor's plan is an important step towards ensuring that everyone gets the care that they need. The state licensing department, or LARA, will now write the rules requiring the training. The governor says she and her office will take part in implicit bias training as well. Reporting in studio, Heather Walker, News 8.